Okay. So, hello, fellow doctors. For the people who are aware of me, thank you for knowing me. And for the people who are new to this thing, my name is Dr. Shahbaz Ansari, and I am a graduate of Sindh Medical College. I graduated in 2017 December, and then I gave my FCPS Part 1 and did my surgical residency for 6 months. But that didn't seem the right thing, so I continued to pursue my PLAB 2 journey from November 2019, I gave my OET, then I gave my PLAB 1 in the consecutive year in March 2020. And then I gave my PLAB 2 in the next year on March 5th, 2021. And as of now, I am fully GMC registered and licensed to work as a doctor in UK and awaiting to join NHS to initiate my NHS journey. And this is just a small initiative in order to help my fellow doctors and help my junior colleagues and my fellow colleagues to initiate the UK journey, as I am pretty much aware of the problems that were faced by me, and the doctors that are in this session mostly belong from Pakistan. So I'm pretty much aware what problems you might face when you want to start a UK journey. So this session will mostly comprise on OET itself. But if I get time, I might as well answer all of your frequent questions that you would like me to answer. But if I'm not able to address them, you can always DM me or WhatsApp me or Instagram me on my Instagram account. And I promise I will get back to you as soon as possible. So let's get on. First of all, what is OET? What is all this fuss about? So OET is basically an occupational English test, which is an alternate of IELTS. Like the IELTS exams for English, it's the alternate of that exam. Because a lot of doctors wanted to move to UK, to Ireland, to New Zealand, to other countries, but because of the prerequisite of IELTS, a lot of doctors were actually stuck. And even my friends gave multiple attempts of IELTS, but they did not clear. And the criteria in order to get into UK, the IELTS score is required. The postulates that you're being tested on in IELTS is speaking, listening, writing, and reading. And you have to have at least band 7 in everyone, like band 7 in English, speaking, 7 in writing, listening, and reading. Whereas in overall, you have to have a 7.5 bands if you give an IELTS in order to sit for PLAB 1, or if you want to move to Ireland or any other European country. Whereas in OET, you're being tested on the same postulates of speaking, listening, writing, and reading. And the passing criteria is 350 marks in everything, and there's no overall. So you have to have 350 in every postulate: reading, listening, writing, and speaking, which is basically the equivalent of 7 band of IELTS. So you have to have 350 marks in every postulate. So what's the difference between OET and IELTS? What is all this fuss about? So IELTS basically tests your English at an academic level. You have to give an IELTS academia, and it's pretty common, and there are too many academies for this to be prepped in Pakistan itself and in other countries. You can also get online coaching, but IELTS academia basically assesses your English at an academic level. And coming from a doctor's perspective, we are not good at writing, and let's just face it, writing is not a very strong virtue. Therefore, a lot of doctors are actually suffering because of this thing. So they can clear reading, they can clear listening, they can clear speaking as well, but the writing aspect is actually a bit worrisome. Talking about my own experience, I also gave IELTS attempt in 2019 October, and I had like a minimal preparation. I did not give a lot of importance to IELTS because I was pretty confident that I might clear. And at the back of my mind, I was actually prepared that even if I don't clear my IELTS, I will actually go for OET and not waste any time. So that was like a guess attempt for me. So I gave my IELTS in October 2019, and same as goes for other people. I got stuck at 6.5 and I did not waste any time. And the very next month, I booked my OET in Dubai with a minimal amount of practice. The amount of time it took me to process my visa, and that's the amount of time I actually invested in OET. And my attempt was on the 9th of November 2019, and I cleared it. I got sufficient amount of marks in order to sit for my PLAB 1 exam, which I sat for on the consecutive year. So this is, and so what's the difference? In OET, whatever parameters you are checked in, you're basically assessed, your English is being assessed as a doctor, as a medical professional. And every field of medicine, be it a physiotherapist, be it nursing, be it doctors, any occupational therapist, all of them can go for OET if they want. And your clinical information, your clinical knowledge is being assessed via English. So if you're talking to someone in a speaking session, you'll be counseling them, you'll be taking history, you'll be addressing their concerns, which is basically a medical perspective of English, right? So you're doing everything, but as a doctor. If you are reading something, you'll have a medical related text. You might actually get a research. You might actually get a consultation from which you have to gather points. If you're listening anything, you'll actually hear two people having a conversation. One of them will be a doctor and one of them will be a patient. The doctor will be taking the history and the patient will be giving a history, and you'll be basically writing the points down. And in writing, you'll get basically a referral letter where you'll be given a really long text. A sufficient amount of length of text will be given to you, and you'll basically refer them to an appropriate department. So this is what it is. You don't have to write an essay. You don't have to write a task A, a task B, or whatever which is given in IELTS. You don't have to have a casual conversation. So whatever you will have and whatever you will face in OET will be related to your medical field. So that's a bit of a ease that has been given to us when doctors sit in OET. And that is the very reason, because of the emergence of OET, the PLAB seats are actually booming so much that people are unable to book PLAB seats. And the major reason is because the hindrance, because the hurdle of IELTS has been excluded, has been eradicated. And a lot of doctors with a sufficient amount of information and confidence on English can actually give OET with a minimal amount of practice. So yeah, having said that, I've given you an overall view. What's the difference? And compared to the IELTS costs around 30,000 or 32,000, whereas OET costs around 62,000, which is actually double. But if you compare, people actually give multiple attempts of IELTS, and whether if they go for OET, one attempt could be enough. And you can give OET in any country you want. That depends upon you. And because of the emergence of OET and because of the facilities available, initially the dates of OET were very difficult. But right now, since the center has been increased and OET is a bit more recognized now, and people are actually considering OET. So yeah, getting dates for OET will not be an issue. But having said all of that, if you think, if you're aware that your English is really good and you can actually attempt to clear IELTS, you might actually go for IELTS. And depending upon the score, if you clear, that's really good. If you are unable to clear, then I would advise you to not waste time and go for OET itself, because considering PLAB and PLAB 2, PLAB 1 exams, time is of the essence. The exams are not really difficult, but you have to plan it accordingly. If you don't plan it accordingly, you'll waste a lot of time. And whatever time you can avail, the better it is. Because from the moment you start your OET journey till that moment you get your GMC, if the dates are not an issue for you, the journey will not be more than 8 to 9 months. Like if I tell you my experience, my plan to get a GMC registration from an OET was around 8 to 9 months, but because of the COVID scenario, it increased to 15 months. So yeah, it is how it is. So before me getting into the details of OET, I'll be explaining what are the questions that you will be expecting in OET. And I've got a booklet, which is actually the kind of booklet that you get in the exam itself. I'll be sharing it with you and explaining it a bit in a bit more detail for the question that you'll be getting in the exam. But before me getting into it, uh, am I clear up till now? Am I going too fast? Am I going too slow? If any of the doctors have any questions, any queries that they want me to answer, this is the time. Because the more the session is interactive, the better it is, because I've cleared my exams. This is a session to help you fellow doctors. If you've got any questions, I highly encourage to ask. Okay, I've got a question. So you can either type it down, or I guess typing would be easier. Hello, doctor. Thank you for doing this session. You're welcome. Can you guide us how to book the seats? Where can I get OET if it is in Pakistan cities? Well, the thing is, you have to register yourself on OET. Once you Google it, you'll get an OET official website. There, you'll have to make your own what do you call it, profile, register yourself, and then you'll be able to book yourself accordingly. If you want to give in Pakistan, if you want to give in another country, you might as well give it according to your convenience. And yeah, I've told you it costs around 60 to 65 Pakistani rupees. Yes, and you'll be able to see whatever cities. I think it's mostly taken in Karachi, but I'm not aware if it's available in other cities. How to prepare for OET? Yes, I will be telling you that, doctor. Do not worry. So yeah, just drop in the questions, so I'll be able to answer them once I'm done explaining. So this is just me gathering all the questions, so I'll be able to answer them in the last section. So now I'll be sharing you with the screen. Okay. So just give me a thumbs up if you are able to see these, doctors. Are you able to see these, doctors? Okay, amazing. So this is kind of the kind of booklet you'll be expected in the exam itself. This is OET special, OET English test. This is the listening subsection. So this is the kind of question paper that will be given to you. And this listening test will be approximately 40 minutes. And you'll be given this thing to sign in and everything. And with this, you'll be given your earphones, and you'll have 1 to question number 24. So question 24 questions will be related to the one audio you'll be listening, and which will differentiate into 12 questions will be related to one audio, and 12 questions will be related to the second audio. And these two audios will be basically a medical consultation of a doctor and a patient, and you'll be hearing the complaints which will be told by the patient, and the questions will be asked by the doctors. For example, Melissa Gordon, so this is the introduction of the patient, works as a something. So she will tell that I work as a receptionist, I work as a banker, or whatever. Medical history has occasional, she must have some complaints, she must have cough, she must have some chest pain, or anything else. So yeah, having is she, and the third question is she allergic to? So the patient will tell in the audio to the doctor that I'm allergic to penicillin, I'm allergic to peanuts, I'm allergic to whatever there is. So that thing you have to hear and you have to write it down. And just note this one thing, compared to OET IELTS, there is no computer version of OET up till now. So whatever you're doing, you're just listening and you're writing it down. So you'll get a pen, you'll get a pencil and an eraser and a paper where you'll write it down when you hear the audio. So yeah, you'll get one whole consultation with the patient. which you'll be hearing, and you've got 12 questions to answer on that consultation. Then you'll get another consultation, but the pattern of the questions will remain the same. Like in this question number 13, severe knee pain in dash area. So it must be an area of the knee, which the patient will tell once the doctor will ask. So you have to have active listening here. So this is the questions. This is the second audio, and you'll get 12 additional questions. So yeah, you'll have 24 questions up to this medical consultation. So yeah, this is the part A. And after that, you'll have part B. In part B, you'll have question number 25 to question number 30, which will be around 6 questions, where in question number 25, you hear a dietitian talking to a patient, and everything which I'm reading is going to be told on the audio itself. For example, question number 25, you hear a dietitian talking to a patient. What is she doing? And then there'll be audio where you'll have the answer. It'll either be an A, B, or C. So you have to write it down. You have to tick it. So we'll have one question, you'll have 3 options, you'll have 1 audio. You have to just tick the right answer, and you've got 6 audios. Pretty easy. And after that, you'll have part C. Well, compared to part B, in this part, you'll have one conversation which will have no breaks, and basically it'll be a conversation. It'll be like a session which is being conducted on the phone, and one person will be talking, and all the questions will be answered in a consecutive way. For example, when Chris met the patient, he found out that. So this will be a whole conversation with no breaks. So you have to actively listen and tick accordingly. Like when Chris met the patient, he found out that. What did he found out? So yeah, you'll hear it in the conversation. So there'll be no breaks, nothing. Same, there'll be another conversation, or a person will be talking, and there'll be no breaks. And you'll have to just tick the right option. Okay, so all of these questions will contain 42 questions. And in order to pass, in order to get your desired marks, you have to just correct 20 questions. That's all. Like from 42, you have to get right 20 questions. That's 350 marks. Pretty easy. After that, you'll have reading booklet and the reading subtext, and this is all continuous, so there's no break. Okay, so in reading, it's a bit different. You'll have 2 booklets, and one booklet will be part A. The first part is part A, and where you'll get which will be for 15 minutes. You'll get 2 booklets for it. One will be the booklet which will have the text, and one will be the booklet which will have the question paper. Okay, so this is question part A, where there will be a text. With this will be for 15 minutes, and you'll have 2 booklets, one the reading text, and one the question paper which has the questions. So the reading booklet will have text A like this, and text B like this, and text C like this, and text D like this. So they'll have 4 sections with text A, text B, text C, and text D. So you'll have to just screen them in a very quick manner. Then this will be the question paper, and out of this will contain around 20 questions. And out of these 20 questions, from question 1 to question number 7, which are 7 questions, you'll get a question like the risk of feeding a child via an NG tube. So where is this thing written in the reading booklet, which is the booklet number 1? You just have to write it in text A, B, C, or D. That's all. And being a doctor, being a medical personnel, if you scout a paragraph, if you scout a text, if you just screen it, you'll have a very good understanding, okay, where does it fit? That's all. Where the risk will be mentioned, it will be somewhere there. And after that, for example, calculating the length of the tube that will be required for a patient. So where will be the length of the tube written? So it's somewhere around where the measurements is being taken or the prerequisite being said. It's pretty easy. You just basically have to screen the tasks, screen the text A, B, C, and D, and you have to answer it like this is written in text A, text B, text C, or text D. So you have 7 questions for this. And after that, you have straightforward questions. A, 1, 2, 3, 4, 5, and 6, 7, 8 questions will be simple questions. What type of tube should you use for a patient who needs NG feeding for an extended period of time? So it'll be mentioned like the types of NG tube and everything will be written. Okay, this type of NG tube will be there. So it's pretty easy. Once you screen the task, once you screen the text, you'll be able to understand that what will be written where. And this is what we do in day life as we are doctors. We know what is important and what is not important. And the last thing will be question number 16 to question number 20, which are 5 questions. It'll be simple fill in the blanks. If a feeding tube isn't straight, then when you unwrap it, it should dash what, dash it, dash what. So it'll be written somewhere in the text. And these are basically 20 questions. Once the 15 minutes bell will ring, these 2 booklets will be taken from you, period. So you'll not be able to review them. You'll not be able to fill them again. You'll not be able to check them. And you'll have to basically train your mind in such a way that you'll be able to, what do you call it, answer all of the questions in 15 minutes itself. It does sound a bit overwhelming. It does sound a bit tricky, but trust me, it's the easiest part of the reading section. Yeah, if you get all of these questions correct, you basically have cleared your reading section, because you have cleared uh, you have to only clear 20 questions out of 42 question itself. So even if you get all of these questions correct, you basically met your criteria. Okay. And after that, once this task has been taken, 15 minutes bell is over, you'll be able to. Doctor's mic is unmuted. I'm really sorry. So once the task A is over, you'll be given another notebook, and as it's written, it's for 45 minutes. So the initial one was for 15 minutes, and the second book will be for 45 minutes. Okay, and it'll be the part B will be there'll be a question, and there are 3 options, and this is a text. So the answer is somewhere in this text. Pretty simple. And these kind of questions will be like this is 1, 2, 3, 4, 5, and 6. So 6 questions will be like this: a question, 3 options, and a small passage where the answer lies. Pretty simple. Okay. After that, you'll have task C. So task C is a bit tricky because every statement, every sentence is a complex sentence. So it's a bit trickier where you'll have this long essay. It'll be mostly like a medical research or an article or something of that sort. So you'll have question number 7 to question number 14, which are around 7 to 8 questions. So you'll have 1 question and the other 3 options. And the first question will be in the first paragraph. The second question's answer will be in the second paragraph. The third question answer will be in the third paragraph. So you'll have 7 to 8 questions in a line. Okay. So 7 to 8 questions from the above mentioned passage. Then you'll have another passage, and it'll be as long as the first passage. And you'll have 7 questions for this passage. Simple. 1 question, 3 options, and the answer is mentioned somewhere above in the task. And mostly it's either mentioned in the question, like for example, in question number 16, in the second paragraph, the writer suggests that one category of non-compliance is, so it's mentioned that the answer lies in the second paragraph. So you have to just go to the second paragraph, and it's mostly written in the third paragraph. So where does the answer lies? So yeah, You have to you have to train your mind in a such a way, because in this task, every sentence is a complex sentence. Initially they'll say yes, then say no, then it might be a might be. So you have to train your mind in such a way. And you'll get around 42 questions in this reading subtext as well, from which you have to clear only 20 questions in order to meet the criteria. So yeah, that's pretty doable. After that, let's come to the writing subtext. Uh, Here, you'll get two booklets. One will be for writing, and one will be the basically the task. Okay, and it will be around for 45 minutes. From 45 minutes, 5 minutes will be destinedly given in order to read, and you are not allowed to touch the pen. So 5 minutes will be given to you to just read the task. And after that, once they'll tell you, okay, 5 minutes are over, now you can start writing. So 40 minutes will be given to you to just write it down and scout it. And just rest assured, doctors, no booklet will be taken from you after 5 minutes. So both the booklets will be with you. You can always review from the notes itself. So this will be the note of a patient. This will be basically a history of the patient written down in detail. And at the bottom of the second page, you'll have the task. So the task is, using the information in the case notes, write a referral letter to Dr. Grantley Cross, an endocrinologist, requesting assessment and management plan for your patient. Address your letter to Dr. Grantley Cross, consultant endocrinologist, City Hospital, Suite 3255 Main Road, Newtown. So you have to address your letter to this person and refer this patient to him for further management and assessment. In your answer, expand your relevant notes and use complete sentences. Do not use note form, use a letter format, and your writing limit of the words should be from 180 words to 200 words. Period. That's all. That's the one task that you have to do in a writing scenario. So yeah, once it's done, your writing task is over. So compared to IELTS, it's pretty easy, where IELTS you have to have two tasks, and in OET you just have to have one task in which you have to write a referral letter. So yeah, writing was that. And after that, there's speaking. Speaking, you'll get two speaking scenarios, and there'll be like a play card. So in speaking, it's basically like a role play. So you're playing a role of a doctor, and the person who you'll be sitting, your examiner, will be playing a role of a patient. So there'll be two play cards, like this is one play card and this is the other play card. And this will be a doctor's play card and this will be a patient's play card. So whatever information you have to speak, whatever information you have to give, whatever task you have to approach, everything is written in your doctor's card, and nothing from your own medical information you have to put in. Being as a doctor's task, the patient came to you with flu, recently has now presented with acute shortness of breath, and you diagnose asthma. So your diagnosis has been made, what is the presentation and what happened. So it's everything is being told, and your task is basically to find out what the patient knows about asthma, explain what are the causes of asthma, which I also mentioned in the preceding part of the sentence: environmental factors, inherited predisposition. And your third is discuss the treatment plan, which is also mentioned as Ventolin and salbutamol. And after that, reassure the patient the safety of Ventolin, deal with the patient's anxiety about the problems, emphasize that it can be controlled. So everything is written. There's nothing that you have to speak from your own. And even if you do not possess, or even if you're not in touch with your clinical background, it's absolutely fine, because whatever is written there, you have to basically own it and say it in your own words. That they'll give you 1 minute to prepare, then 5 minutes of conversation will be happening between you and the patient itself, which will be your examiner. So yeah, this is the one task, and there will be similarly another task, and there's no difference between both the tasks. So yeah, 1 minute of preparation time and 5 minutes of speaking time, and it's absolutely fine. So yes, this is about it, about the subtext and the details. And Yes, so it's absolutely fine that you are unable to talk for 5 minutes itself. But if you meet the criteria of the task, if you are able to do everything which was required and which was asked for in the task, your task is met, your job is done, and it's absolutely fine. And what you have to do is basically you have to address all the concerns, answer all the questions, and be empathic and sympathetic, and be an active listener. So yeah, that's pretty much OET. Okay, so I hope I was able to summarize, and I can understand that it's pretty much too much to take in at once. So you'll be able to review this video later on if you want to, and I'll be posting the link on the group as well once the link is ready. Yes, so yeah, I am pretty much done, and so you have to clear around 20 questions in listening out of 42 and 20 questions in reading out of 22. So yeah, how to prepare for OET. Dr. Simmons, so basically you have to prepare for OET by practicing. And I'll be sharing the practice material, which I have as well. If any of the doctors require, and even if I forget, you might as well drop an innocent text in the group in order to remind me. So I'll be sharing whatever material I have with me. Any common mistakes doctors make during exams, do cover those in booking. Well, the thing is that a lot of doctors actually kind of underestimate this exam as well, and a lot of doctors do overestimate the exam. It's pretty doable exam, but still it's an exam, so do not take it too lightly. Because when I was giving my exam, there was a fellow doctor with me in the test, and he was so confused in the exam that I actually did help him during the reading part. And yeah, so basically practice it and train your mind accordingly. Do you think preparing for IELTS? Well, I never prepared for IELTS, but it's basically in English, right? So even if you prepare for IELTS, it's going to help you for OET. So yes, how to start for OET? Tell us about the whole material. So if what I followed for OET was E2J, which is available on YouTube, it is absolutely free of cost. And if you want to actually practice the actual test, so 3 to 4 tests are actually given by OET officials itself on its website in order for people to practice, and they're absolutely free. So you can actually go and practice from there as well. Does OET have any relevance in USMLE? Well, it's a really question, Dr. Javad. But because of the COVID scenario, a lot of the people were unable to travel to US for the CS exam, and therefore they actually exchanged CS from OET. So if you have given OET, your CS is exempted. But you have to check the details on the USMLE platform itself, as a lot of friends of mine actually became an MD as they had already given their OET and were actually awaiting for CS itself. In the listening, recording will be played. No, it will be played only once, no twice. How does the OET help for PLAB 2? Well, Dr. Tabassum, OET is basically a prerequisite, as OET and IELTS are the prerequisites of PLAB 1. If you want to work as a doctor in UK, you'll have to get a registration from their medical council, and in order to get them, you'll have to clear all these exams. So they've got PLAB exams, PLAB 1 and PLAB 2, and in order to sit in PLAB 1 exam, you have to clear their English exam, which is IELTS or OET. And even if you don't want to go to UK, a lot of people actually want to work in Ireland as medical officer. In order to work as in UK or in Ireland, Scotland, or any European country, you do need to clear an OET or IELTS in order to um, verify that you are actually aware of English and you do have sound information, sound knowledge of English. In listening section, does the time limit? Is the time limited only till the duration of the audio? Well, yes. Once the audio is done, they'll give you a certain amount of time, but I think it's not enough, because the whole question booklet will be with you in the listening part, and once the audios are done, you're done. And it's not like if you have heard the information, the audio for part A, you won't be able to fill it later on. You can, but it's just a bit tricky, because once you're doing the other part, it'll be very difficult for you to come to the earlier part later on. Do they take the booklet of, well, in the reading, for part A, they do take the booklet back, but in the parts B and C, the booklet will remain with you, which only happens in the reading section. So in the listening section, the booklet will be with you throughout the exam, till the listening section is over. Doctor, this is a bit aside the point, but how much priority should we give to publishing research? Well, the if you have got publication, that's a really good point, because it actually adds on your CV. So it basically gives your CV a bit of a star. So yeah, I've got less than 1 minute left, and YouTube and the Zoom session won't allow me. So I'll try to answer all the questions, but I just don't want to end this session abruptly. So yeah, if you have any questions for me, I'm really sorry if I was unable to, I'm unable to answer all the questions, but if you want to ask me the questions, you might actually DM me or drop a text on the WhatsApp group. And if you want to listen to this again, you can view it on the YouTube. I'll be sharing the link. And thank you for having me. It was really nice having you people, and I hope you people have a really nice night. So bye bye.